Thank you to those of you that are following us. I do have a very special guest on today, and I am also going to be introducing my co-host here that is going to be helping me as well. Co-host today, Helen. Hi, Helen.
Hello, everybody.
And so she's going to be co-hosting with me today. We have a very special guest on today who's going to be talking to us about eating disorders. Our guest today is Bridget McCauley. She is a licensed professional counselor who received her master's degree in counseling from St. Edward's University. She has worked extensively with individuals and their families in all levels of care. With her training and expertise in eating disorders, substance abuse, developmental trauma, and health psychology, she has a special interest in treating adolescents and their families to move toward eating disorder recovery. She has extensive program development and management expertise and experience, and currently oversees Clementine's adolescent residential program here in the Woodlands, Texas. So before I have her on, I do want to let you know that this is a program here in the Woodlands, and if you want to find out some more information about it, you can always go to ClementinePrograms.com. That's CLEMENTINE programs.com. Hello, Bridget. Thank you so much for joining us.
Thank you so much for having me. I'm happy to be here.
Thank you. And tell us a little bit, for our listeners who are just joining us for the first time, tell us a little bit about your program and what you do.
Sure, I'd be happy to. So we are an adolescent residential treatment center, as you said, in the Woodlands, Texas, so just outside of Houston. So we're able to serve the greater Houston area. And we work with adolescent females age 11 to 17. We're able to have girls here until their 18th birthday, and we're able to provide the highest level of care that's not in a hospital setting. So again, we're residential 24-hour care, and we work with adolescents and families as they recover from eating disorders, and it can be any eating disorder. We treat all eating disorders, and again, this is for the people who need that extra support, the highest level of care possible, but we could keep them out of the hospital and still have their family really engaged in the process.
So for our listeners that are not aware, tell us a little bit about what eating disorders we're talking about.
Absolutely. So mainly the people that we find that are seeking treatment have anorexia nervosa. Some may have bulimia nervosa, binge eating disorder. We also see clients who are struggling with avoidant restrictive food intake disorder. It's called ARFID, and that's a newer diagnosis as well as binge eating disorder in the DSM-5 that was most recently published. So those are the primary diagnoses that we see. The clients in our care have to have a primary diagnosis of an eating disorder, but they may also have a co-occurring diagnosis such as depression, anxiety, PTSD, or really any other co-occurring thing that may come along with their eating disorder. And we want to help them treat those underlying conditions as well, because they've tried to use their eating disorder to cope, and that certainly is not, they're not able to maintain their health by coping with an eating disorder.
Right. So tell me a little bit about the kids, because they're kind of young. You said from the age 12 to 17.
Yes.
So what do you find that's the underlining, I guess I don't want to say cause, because I know some of it is going to be, underlying causes as well. But what do you find is the underlying root of all these eating disorders? Is there something in common that all these girls have that stems from maybe their family environment or their personality or underlying disorder?
Right. Well, you have touched on the highlights of everything that we typically see, and I wish we were able to say, here's the one thing that we have found that these clients do have in common, because I think that would be easier for parents and providers to identify earlier in the process. And I would say it's a combination. Sometimes it's trait and personality and temperament definitely play a role in there. Sometimes there's a genetic predisposition, whether it's a relative who may have had an eating disorder, and something in the environment may have tipped off and set the epigenetics into place for the development of an eating disorder. So that combination of, again, the biological basis and then something environmental. So we do find that is a combination. So what makes that happen for each person, which makes the epigenetics come forward is different. So that's where we look at environmental factors. It could be peer influence. It could be, again, somebody may have had a traumatic experience, whether that was something that was a big trauma or something more personalized to them. That could be an environmental cause as well. We do see a pretty high incidence of co-occurring anxiety, depression, even up to 66% of our clients may have anxiety that precedes the diagnosis of the eating disorder. And so an eating disorder can be very adaptive and as a coping skill.
Right.
It can help quiet the mind, quiet the body, which is counterintuitive when we think about it. It doesn't sound logical in many ways, but it's very adaptive for these clients. And so we really like to help them get nutritionally stabilized, medically stabilized, and so we can look at some of those underlying factors for them. But I would say depression, anxiety, again, PTSD, sometimes something like an obsessive-compulsive disorder may also be an underlying factor as well. Those are the most common that we see.
Mm-hmm. And so did these girls usually, are they coming from the hospital to this residential center? Because they're, I'm assuming they're living there. Are they living day and night in the center?
That's a great question. Yes, they do spend the night here. So they do live here. And we have some who are coming out of the hospital, that inpatient setting. We also have some who are stepping up from maybe a less structured, lower level of care, maybe a day treatment program or an intensive outpatient program, or even just outpatient therapy. So we see, again, people who are stepping up kind of in their treatment process or stepping down. And then some people who residential care may be their first time in treatment. And we're in a home-like setting. We're actually in a home. And we wanted that environment intentionally because it's very healing for the adolescents, especially this age group, to be able to come into a home that we have made into a treatment center, but we've maintained the coziness and the welcoming environment of the home, and we want that for them. We even have a chef who prepares all of our meals on site, and so we want the girls to have that experience of walking into a home and smell dinner cooking and be around and be part of that process. Mm-hmm. And so they do stay here. They do live here. They're also able to stay engaged with school. They can complete their assignments. We can work with their school. We can work with their district to keep them engaged in school and stay as up to date as possible. Again, their priority is the health and their healing while they're here, but we want them to stay engaged in their life, whether that's with their friends, with their school, as much as possible and as much as is healthy for them.
So you have a structured program, it sounds like, where they're getting therapy or there's medical doctors that are seeing them. What does the structure look like day by day?
Day to day. We have a combination of, first of all, our program is 7 days a week, 365 days a year, so we're always open. And throughout the week, they have a combination of individual therapy sessions with a registered dietitian. They have group therapy every day. We do have a psychiatrist who meets with every client as well as a nurse practitioner who follows them medically. And we have a family therapist as well. And so their days are comprised of school. They start every day with school, not on the weekends, but Monday through Friday they do start with school. And then the rest of their day is comprised of eating, group therapy, and eating is really meal support therapy. And for those who are working on recovering from an eating disorder, we're asking them to engage with their most feared substance multiple times a day. And so we really treat that as a therapeutic meal. Our staff members provide support for the clients as they are working to heal their relationship with food in their body, and we do that through the supportive meals. And so, again, those are cooked on site. And the rest of the day is a combination of a group therapy and individual therapy. We think that group therapy is really important for them to be able to interact with peers who are in a similar position, and so they can have that practice of the peer interaction as part of their healing process as well. And so that is what they do all week, every day and all week. And then when we are not in coronavirus time, we do have them go on outings to practice some social skills, therapeutic outings. We also like to take them on a restaurant outing once a week so they they can get practice eating out and normalizing that experience for them as well. And so during this time, we have modified that, and we're bringing food in and trying to do different things so they can have a similar experience. But we want them to have that exposure while they have the support.
What about working out? Do you find that they all want to work out, every day, or how does that balance in there?
Yes, we do find that they want to do that. Many of them are not at a position to do that yet. And so as part of their treatment, we like to look at how we can incorporate movement into their treatment process. We have a certified yoga instructor who comes to the facility 3 times a week, and so they have an opportunity to participate in yoga up to 3 times a week. If they're at a place in their treatment where they may not be medically stable or nutritionally stable, we will not have them participate in movement until they're ready, but we do like that to be an option for them. We also have mindful walks that they can participate in, again, up to 3 times a week as well. And then for those who are much farther along in their treatment, closer to the time that they leave, if they are someone who has even been an athlete or something, we like to talk to them about how to have a different, healthy relationship with movement and exercise. So we definitely stay attuned to that as part of the process as well. Many of them have had use exercise as a way to compensate for eating, for their caloric intake. And so we have to slow that down and let their bodies heal, and then have them have an experience in working with our staff where they can, again, create a new relationship with exercise and really get back to enjoying movement rather than compensating for what they eat or having to earn it.
Right. For those of you just joining us, I'm Dr. Alexandra Simotas. You're listening to Her Sex, Her Health. I'm here with Helen, my co-host, and our special guest today is Bridget McCauley, a licensed professional counselor from the Clementine program and eating disorders inpatient residential program in the Woodlands. And you can find out more about her by going to clementineprograms.com, CLEMENTINE programs.com. Am I pronouncing that right, Bridget?
You are. It's Clementine, like the oranges.
Okay. And before I get to some of the email questions that I have, I'm going to ask you probably what a lot of parents that are listening to this program are wondering, and that is, what are the initial signs that a parent should be watching for, especially with their daughters? And I'm sure that some of this relates to their sons as well, before the onset of an eating disorder occurs. What are the red flags?
Sure, that's a great question. I always lead with telling parents to trust their gut instincts. If they feel like something is amiss, then it is worth checking out. Many adolescents who are developing an eating disorder do not want to be asked about it. They may not like that focus, and so even if you get resistance, I encourage parents to still stay curious about that, because the health consequences are very dire for many adolescents. I would say some of the early signs that you may see physically would be, of course, a sudden weight change, either weight loss, weight gain, that persists, so that it may continue. For some, maybe a sudden interest in exercise or in a new activity that, again, it's a shift. So any shift is really important to stay attuned to. If they weren't interested before, but suddenly they are, especially if you notice a difference in what they're eating. For some adolescents as well, a sudden change and an interest in healthy eating, what we call more of an orthorexic type idea, which is almost an obsession with healthy eating, that needs to be clean eating, or, again, more in an obsessive way, beyond just kind of a sudden interest or curiosity. But if you find a rigid thought process around it, then that's definitely a cue that it's more than just curiosity about that. You may also see some symptoms that are more associated with depression, so that they may be withdrawn on top of that. They may isolate a little bit more. They may try to hide their bodies with wearing baggy clothes, or some even may wear more revealing clothes to expose their bodies a little bit more, and then they may hide their bodies because there is some shame if they continue to lose weight and they don't want to be noticed. I'm trying to think what else. Some of the other things, like you may notice that hair might start falling out. That is a sign of malnutrition as well. So temperature dysregulation is another cue. But I would say watch if they start to move away from sitting down for the family meal as well. If they are not eating at school, if they leave with a packed lunch and then not bring the packed lunch, or bring the packed lunch home, or things like that. So again, if you notice some of those sudden changes, I would encourage parents to stay curious about that.
Okay. I'm going to let Helen reach out to some of her mom's groups and has some questions. So I'm going to let her chime in here. And you can keep it anonymously or you can cite the reader.
No, I'm not going to. Yes,
okay.
I had some of my mom's group friends that I emailed, and of course it was a very hot topic for a lot of parents, especially of young girls. I noticed it was more prevalent towards the girls. Do you find that in your facility in Clementine House, that it's more female, or?
They're all female, right?
Oh, it's all female.
You're all female there, right, Bridget?
We are, and we do find that overall more girls are diagnosed with eating disorders. We're seeing that slowly change in the field of eating disorders, and that fortunately more males are seeking treatment as well. But yes, our facility is just female.
Okay, so one of the questions I had is, should you, like a 9, 10, 11, 12-year-old girl, do you as a parent allow them to self-regulate as far as eating regular foods, or do you have to tell them, like while they're eating, do you tell them if you're not hungry you can stop eating, or if you're full, do you try to get them to notice if they're full or not and tell them that they should stop eating? Do you supposed to just trust that kids can kind of self-regulate, that they will know when, like, to not gorge or to not binge and to eat whenever they're hungry and to stop when they're full?
Without mentioning it.
Without
just
mentioning it.
Yeah. What do you think about that, Bridget?
Such a treacherous slope there. I would say, so overall, when we look at healing, helping them heal their body and their relationship with food, the goal is to have them get to the place where they can be aware of their own body cues. And so I would say if you have a child who has been able to identify those cues, even up till, I know you said 9, 10, 11, if they've been able to do that, kind of eat a little more intuitively, because babies naturally eat intuitively when we just sit back and let that happen, I would say that to continue to go with it. What you don't want to do is add additional emotion around food. You don't want to make it a battle. Sometimes think of ways, age-appropriate ways to help them understand, like, you say that you're full. How do you know you're full? Get them to use descriptive words. I think that can be really helpful, because a 9-year-old will describe it very differently than a 14-year-old. But I think that being able to understand their language and helping them form an understanding of that, their connection with their own body, is always a good thing to do. And so I would encourage, again, some curiosity around it, open discussion around it. What you want to avoid or steer away from is a lot of emotion around it, that idea that you're forcing food. If you get into a battle with it, that's generally not a good idea. But I think encouraging their understanding of their body is actually important. And sometimes they may need help with regulation. And so if they've had a day where they've been really active, they may be hungrier, and that's okay. So what we really want to model is, every day may not look the same, and that's okay. And so helping them understand what they might want to eat. So again, working with that curiosity. Do you want chicken today? Do you want peanut butter today? And helping them make those decisions on their own and having them as part of the process, I think can be really helpful if they're interested. Again, the main thing that stands out to me is I would avoid the battle.
Right. So what happens when your child wakes up in the morning and you're like, okay, do you guys want breakfast? And they're like, no, we don't want breakfast. Then what do you say?
That's hard. That's a really hard one, because for many kids, even for many adults, they may be really hungry an hour later. But we're trying to get them out the door to school. We have 30 minutes. The window is short, and it has to all be done. And so I would always encourage to offer the food, make it available. Again, know your child. Some in order for their brain to work, in order for their body to work, in order for them to not have a meltdown the minute they walk in the school door, they need food. They just need more food. And so with those kids, I would probably offer a little more encouragement. For the ones that don't, you may think, do I need to shift my morning routine 10 or 15 minutes to allow a little more time, because they may be hungry if they have that extra 10 minutes. But our mornings are so rushed, it's hard to do. So I don't think it's worth forcing it. I would always offer it. So you don't want to set the tone of, skipping breakfast doesn't matter. Or have something small out that might feel more like a snack, but at least they have something in their body so their metabolism their body can wake up. That's probably the best way to think of it.
Right, that's nice.
One of the other questions I had, and you mentioned some, I didn't know there was a word for it, actually. You mentioned some obsession with healthy eating. What is that word called?
Orthorexia?
Yes. So, for instance, that's kind of tricky, too, because as parents, we try to encourage our kids to eat healthy. And I know some of my moms in their households, they have a rule where they have, they call it a fun food, for instance, and they say you can have one fun food a day or a week. And so they don't have, you look in their pantry, there's absolutely no sweets in there because they don't want their kids encouraging it. But, some of the parents' philosophy is, I will have the ding-dongs there and trust that they will be able to self-regulate, and if I see them abusing it, then I will do something about it, but they should be available so that they won't feel deprived. What is your opinion about that?
It's a good question.
That's another tricky one as well. It's a great question. I think what we don't want to do is set any kind of tone of there's any shame with food, like, oh, we can't have chocolate around the house, we can't have ding-dongs at the house, we can't, because again, some kids, you could say that, and it does not mean anything to them. You could say that to the next child, and that child may be one that develops an eating disorder. So it's not necessarily a cause and effect, that if I leave those in the pantry, then that my child's going to have an eating disorder, or vice versa. But I think it's developing that awareness of what judgments do we have about food, what are we communicating in the home, what are we modeling in the home, what tone are we setting. So if there's that emotion, that intensity around these are forbidden foods, or they must be earned, or they must be deserved, or not deserved, that's the trap, and that's where people get stuck. So overall, I think it's best to have those things just as an option, as part of life. And maybe you don't always buy them, but I think the idea that they are available is what is healthy, and then guiding children to, there's nothing wrong with having some structure around it, but if it's you can only have, sweets once a week or something like that, that is more of a trap that doesn't work. And so I think it's having it, again, available in a way, but it doesn't have to be out and then giving them ideas that you can have that instead of dinner, or you can have that instead of something else. But you don't want to set the tone of, again, having any kind of shame or emotion around the food, because food is food. Again, we don't have to earn it. You don't get to have a cookie because you were good today. And so there's some language pieces around this that I think are really important.
Well, what do you do? How do you teach them structure? Like, I know that some families will say, okay, you have 10 sweet tickets a week, and you can use your tickets. Like, how do you teach them? That's the only time I heard that, a parent putting a structure around a child by giving them tokens or, something. Or do you just say what you said? Well, whenever you want after dinner, if you want to have something sweet, you can. Or, how do you teach them that structure, that it's not okay to have the whole cake, or basically it is okay to have the whole cake, but you're going to feel bad about it? Like, how do they learn that moderation?
Well, and here's the tricky part. So our bodies naturally have the moderation. It's when the brain gets in the way. And so what we're working on is, of course, by the time that they're in residential care, we're really working on the thought process around it at the same time. And so your body probably is not going to want to eat a whole cake. Now, that, of course, some people still do, but when we step out of the way and say, it's available if you want it, most of the time people are not going to be inclined to eat it. Now, that's not true, of course, in eating disorder recovery, and that's why we're doing the work that we do. And so that's where I think having things accessible and available is important. And it can even be a teaching tool because, again, many kids, you may give them a piece of cake and they may not even want to eat the whole thing. And so if it feels like it's restricted, though, if it feels like you can't have it today, you can't have it tomorrow, you can't have it the next day, then when they do get it, they may feel like they have to eat it all. And so that sets up kind of that scarcity mindset, like if I don't have it right now, then I may never get it again. And so I have to consume whatever I can when I have the opportunity to do it.
Right.
I guess I feel like...
So that's the hard part.
Overall, I feel like, as adults, as parents, as women who some parents have eating disorders or have had eating disorders or have struggled with food, and I feel like sometimes they kind of put that on their children and they'll sit down and say, if you want to have the whole cake, you can have it. But because you don't want your kid to feel deprived. But I think generally you don't have to say these things to children. They kind of know.
Exactly.
You don't.
Exactly.
You don't. So when you bring it up because you have issues, then you kind of are making it an issue to this child who otherwise would have been perfectly fine eating one piece of cake.
Exactly. You're absolutely right. I think it's when we add all of that onto it and all the worry and the stress and the content around it, they pick up on that.
Yeah. For those of you just joining us, I'm Dr. Alexandra Simotas. You're listening to Her Sex, Her Health. I have Bridget McCauley from McCauley. I have Bridget McCauley from the ClementPrograms.com, and she is speaking to us today about eating disorders. She has extensive program development and management experience, and currently oversees the Clementine's Adolescent Residential Program in the Woodlands, Texas. And you can find out more about her by going to ClementinePrograms.com. And if you didn't get an opportunity to email me your questions, and I know some of you have, you can always follow up by going to SimotasMD.com. That's SIMOTASMD.com. And you can shoot me an email through my website, and I will make sure Bridget gets it and that you get in touch with her. I have a question, Bridget, from Samantha out in Conroe. She goes, "Hi, Dr. Simotas. Can you ask the psychologist about my daughter? She is 12 years old, and currently she weighs herself in the morning and at night. I try to hide the scale from her, but she always finds it. She is eating normally now, but I know that she is worried about her weight, and I do find her exercising more. But is it a good or bad thing for her to weigh herself on a daily basis?" Thank you, Samantha, for that email. Bridget, do you have any thoughts about, I guess the girl is 12 years old and she weighs herself on a daily basis?
Oh, and I can hear that mother's anxiety as she writes that as well. I would say, no, it isn't, and actually it isn't really healthy it is not healthy for a 12-year-old to weigh themselves every day. And it's not normal for adolescents actually to be on diets, really. And so that the hyper-focus on body and weight is, you asked earlier about some of the risk factors or things that parents could look for. Weighing themselves would be another one, or that, again, hyper-focus on their body and some of the changes. So, no, that wouldn't be healthy for an adolescent to be so focused on weight and a number. I mean, that's really boiling down to a number, this 12-year-old just focusing on that. So we really want to move away from, again, the kind of diet culture, diet mentality, the good, bad. You're good if you weigh a certain amount, bad if you weigh a certain amount. That's really what is going to get in the way of us being able to do what we were just talking about, eating more intuitively in bodies to naturally stabilize. It's also important to remember that adolescents or kids as they go through puberty will gain an average of 4 to 6 pounds a year, some more, and they will grow 2 to 4 inches in height. And those are some averages. And it's hard for them to understand all the changes in their body. And so I would also encourage parents to be sure you're talking about that. Now, your body is not going to stay exactly the same as you grow older, especially during those years. And that's really important to normalize that process, because I think it's really scary for kids as their bodies start to to change. And so I think that's another thing to really remember. That is the time in life of the most body changes for them, and it's hard for them to understand.
And so what does this mom do if her daughter's weighing herself every day? Does she take the scale away from her, or what's the next step?
I would definitely encourage her to reach out to a local professional who obviously see her physician. Reach out to a local professional who might work with eating disorders. Of course, I cannot say that this child has an eating disorder. I think it's concerning to have her have that pattern. And so in order to allow the parents to have some education on how they could support their daughter, I would definitely encourage them to do that. There's a great resource in the Houston area. The Houston Eating Disorder Specialist has a website with some excellent therapists and clinicians there, and just for her to get some information. I would encourage her to have a conversation with her daughter about it, not just take the scale away. I think talking about it first is really important. If you just take it away, then she might be more inclined to try to get it back. But I absolutely think that parents should ask her about it, become curious about what's going on with her, helping her understand why is she focused on her body so much right now, because they may be able to understand if there's, again, some underlying anxiety, is there a sudden change in her peer group, things like that. So they could get some information on what else is going on for her. But I would definitely encourage them to reach out and get some help, and then also talk to the daughter as well, because that would be a concerning pattern for her to continue. The main thing that I would also remember is adolescence. It's scary. When we talk about eating disorders, it's very scary, and I think it's important that we talk about the severity of eating disorders, because it's, they're very, still the leading cause of death of all the diagnostic criteria in the DSM-5. Anorexia nervosa is still the leading cause of death. And it's important that we remember that. I will also say, especially with adolescents, the sooner parents are able to seek treatment and have intervention, the better, because the adolescent brain and body is so resilient, even though there's rapid change during this time. We do know that early intervention leads to longer-lasting recovery with this age group.
Do you have any questions? Right.
One thing I was going to ask you.
Thank you for that, Bridget.
You've given some really great information, but one of the things I forgot to ask you about is that how important in the recovery process is actual, like, family involvement, like parents or siblings, or can these children who might not have that family stability and structure still have a chance to recover with the therapy that y'all provide if they're lacking that family involvement in their recovery?
Sure. Especially with this age group, I think family involvement is very important. And here at Clementine, we have the family as an integral part of the process. And by that, I'm involved in the family therapy, we do family coaching as well with the parents. They're also very involved in the nutrition piece of the program as well, whether that's having meals with their adolescent. It's also, again, a lot of nutrition education for them. And so I do think it's very important, because many adolescents are not feeding themselves. Some are. And we will work with whomever they identify as their family, as their primary caregiver. And that's not always, a parent. And that isn't, even if we have two working parents, and it's hard for them to be as engaged in the process, we will meet them wherever they are and work with them from that perspective and realize it's not idealized. But I would say it's really important that parents are involved in the process, because if the adolescent was able to take care of themselves, then they probably wouldn't be struggling so much, and that's not a failure on their part. Your kids this age are just not wired to be able to know what they always need, or meet all of their body needs, or handle the amount of stress that they are trying to carry throughout the day. And so the family involvement is actually very important. And again, it's whoever is involved in their family. And siblings are important to include in the process as well, because when there's an eating disorder present in the family, it shifts the whole system. And so it's really important that we acknowledge that in the healing process, because something wasn't working. And again, that's not a failure on anybody's part. This is our chance to actually pause and reflect, see what's working, see what's not working, help families shift their system, and then actually get on a trajectory to good health.
I'm going to ask you this, and I read this pillow one time. It said, "Quit blaming your mother; it's your father's fault." But in general, I was under the impression, from the little that I know, because we don't study this in medical school extensively, but that these children have overbearing mothers. Is that, or controlling mothers, and that controlling their intake of food is their way of controlling themselves because their mother is overbearing? Is there any truth to that? Do you see that in your center?
Oh gosh, I think it's also Freud who said if it's not one thing, it's your mother.
Right.
I would say, some people will say eating disorders are about control, and I do think there's a control element to it, but not just about control, and so I hate to simplify it in that way. I do think what they're trying to do is get control over their environment in some way. And so if there's a home environment that is chaotic, or, that they may have a parent who's more, again, what you're describing is kind of that overbearing, then they need to control their own internal world in some way. And so some of that do develop the eating disorder as a way to do that. Again, it calms the mind, it calms the body. It's a little counterintuitive for us to think of it that way, but it truly does. And so we will sometimes see, again, like a disruption in the family system, and not a failure on anybody's part, but a way that the child is trying to communicate that something is amiss, something isn't quite right. And so we always look at the family relationships as a part of that. And so I wish we would be able to say, I wish and I don't, that it's just overbearing mother, but I would say we look more at how are they trying to gain control of their environment somehow. Right.
This question is from Louisa, and she says, "Hi, Dr. Simotas. I'll be listening to this on KPFT.org on the archives. My question is, what should I do when my daughter, who is 7 years old, asks me every day if she can eat something sweet? She points to the refrigerator if we have ice cream, or she'll point to the cabinets if we have cookies, and she asks me, 'Can I eat this?' What should my response be?" And thank you, Louisa, for that email, and let me know if you have any follow-up questions. What do you think about that, Bridget, when your daughter asks you, "Can I eat this?" What's the answer?
Well, so my first thought when you say that is what we do with many of our clients here. When are you hungry? Do you need a snack? So kind of as a parent, step back and go through that thought process for yourself. Like, okay, when is the last time they did eat? She could really be hungry. And we know sometimes when we're hungry, or even beyond hungry, we may be more inclined to biochemically search for something that's more carb dense or sweet or sugary. And so that's one of the first things I would say. And so that's the type of situation where you could offer a snack or offer something else if you realize, okay, she probably hasn't eaten in a while, or maybe she didn't get enough protein earlier. So there could be a physiological piece to that craving that I think we as adults have to be attuned to, because they will not be. And so that's the first thing that comes to mind for me. And those are the types of situations where, again, there's nothing wrong with saying, actually, let's have another snack. The sweet or the piece of cake or the ice cream we don't always want that to be the snack. So you're teaching them more of that normalized pattern. Every time, as adults, if we're hungry, if we would eat the ice cream every time, your body's just not going to feel good. Right. And so a 7-year-old won't have that attunement, so we have to step in and do that for them. But we don't want to say never the ice cream, but from a physiological perspective, what else might your body need? And so that's the first thought that comes to mind. Again, not a forbid the ice cream, but what else might she need?
Right. You mentioned in your center that you involve the girls in cooking. Is there any thought about involving kids that you are worried might develop eating disorders into the cooking process? Do they need to see how the food is prepared? Does that help at all?
So it's not uncommon for many of our clients to be very interested in food. And I think that is just an underlying interest, period. Some of them, though, they may be very interested in cooking or baking, and then they will not eat the food. So again, getting back to your earlier question, things for parents to look for, if there's this, again, sometimes a sudden interest in cooking or baking or really being a part of that process or recipes, or even some of the TV cooking shows, but then they don't eat, then that's another cue to pay attention to. Because what they're doing, their brains are hungry, kind of starving in a way, but it's almost like they're mentally consuming food, but then they're restricting their body. I think it's always great to have kids involved in the meal prep process, whatever that looks like. And again, it could look different at different ages. And that's how they can see that you can have fun with food. You can, plan, one family meal a month or something where everybody participates. You don't have to overthink it too much. But I think it's helpful to have them as part of the process because big picture, what you're doing is helping them develop a relationship with food. And that also involves food preparation. That involves being around food, being exposed to different foods. They could develop some curiosity about foods. And so I think when possible, I think that's actually helpful. If you see, though, that they start to develop more of that unhealthier relationship with food, again, they're cooking but not eating, or they're saying we should have a lower calorie ingredient, or that ingredient has too much fat. If you start to hear some of those things, then they may not need to be a part of that process at that point. But again, try to gently steer them away from that to see where their mind may be before you just restrict it or cut it off.
How do you in general, if you're in a situation where you're sitting down at the dinner table and you have somebody that clearly hasn't eaten and they need to eat their dinner or their lunch and they say I'm not hungry, when you know that that's not true, Bridget, how do you make somebody eat?
Again, that's one of the hardest things. And this is a question where you will find different schools of thought. We come more from the intuitive eating mindset, really trying to develop that healthy relationship with food, and our goal is to help them nourish their body. And so again, as we are looking from the perspective of treating adolescents with eating disorders, and so our primary goal is to nourish the body. And so we will offer that meal support for them essentially until they are able to eat. If they are not able to complete their meal to get their nutrition here, then we will offer a supplement for them because it's the nutrition that's really important. At home, I think, again, most often kids will intuitively eat, or they are hungry and they will eventually eat. You want to avoid the power struggle around it. And if you find that they may not eat dinner one night, then they may eat breakfast the following morning. I think if you find that that's a pattern that's ongoing, then I would encourage people, of course, to check in with your healthcare provider and things like that. But what you want to avoid is that power struggle. And many times the child, excuse me, will end up eating because their body will tell them to if their brains don't get in the way.
So if your child says, I'm just not hungry, should you say that's fine? You can eat whenever you're hungry? I would again offer the food, have them sit down at the dinner table, have them try to have something. I do think it's important to, again, for them to get some of the nutrition. Again, there's nothing wrong with saying, and this is dinner, we're not going to have a second dinner. We're not going to prepare something else. Right.
But it's more how do we need to look at how we're structuring things that there's something that's making that harder for them or something that's getting in the way for them. Because that family meal time is really important, and I know it's really hard for us to do that with busy lives, but more that structure around meal times is actually pretty important and important to think about. Even if we only have 10 or 15 minutes to sit down and do it together, that's something.
Right.
And so I would say it's more around the structure of it, but again, it's absolutely okay to say this is our dinner and this is our dinner time, and you sure you're not hungry? Because you will be going to bed soon and your brain needs to work, and those discussions on an ongoing basis are important.
Let me just interject real quick. If there is a young child under the age of 10 who is even saying things on a daily basis that, like, I'm not hungry, even if it's something that the person, the child will enjoy eating, Is that something
Right.
to be concerned about? Like, do kids walk around saying, I'm not hungry when you're giving, like it's a normal,
No.
they don't?
Not typically. And I'm glad you brought that up. If you have that, again, if it's ongoing, then I would definitely encourage that parent to check in with their pediatrician, check in with the healthcare provider, also to make sure that there isn't, something physiological going on for that child, that there wasn't a sudden change or something like that. That's always important to check out. But no, that wouldn't be normal on an ongoing basis, especially if you see that with them not eating. Now, they may say, I'm not hungry, and they're still eating. Okay, then we know they're getting, again, the nutrition in. I would still check in with your healthcare provider about that, but that would not be normal. Because, again, most kids will eat more intuitively.
Right. But when they say I'm not hungry, if you, like you mentioned before, if you wait a little bit, then they may be hungry later, right?
Right.
What is there something wrong with saying when they letting them eat in front of the television set to distract them when they're not wanting to eat at the dinner table?
Well, here's where...
I mean, I know it's bad manners, but I'm just saying it for the goal of getting them to eat.
Yeah. Yes. I would say there's nothing wrong with it. And so if that turns out to be more of an occasional thing, again, nothing wrong with it. Don't overthink it. We also don't want parents to try to get in this perfectionistic mindset that it has to look one way. And so there's nothing wrong with that necessarily. What you don't want to practice probably is that could potentially lead to more mindless eating. And so if they're watching in front of the TV every day for every meal, then they're not going to be as attuned to their body cues of hunger, fullness, things like that. And so that's where that distraction can start to not serve them in the long run. But sure, I mean, if that's what families do occasionally, there's nothing wrong with that, because there's a way to make that fun also. We can enjoy a TV show that we all like and eat together. But I would say, again, if it's more of an ongoing pattern, then you run the risk of that disconnecting from their body.
Right. This is a email from Selena, who is in Sugar Land. She says, "Hi, Dr. Simotas. I have a 15-year-old who is a runner at school. She always complains that her thighs look fat. She looks in the mirror, even though she's thin, and she says that I look fat. I feel fat. Is there anything that I can do to help her understand that her body is normal? And how do I stop her from saying that she feels fat? She almost says that on a daily basis." And thank you so much, Selena, for that email. And again, if we don't answer your question to your satisfaction, please follow up with that email. I know you're going to be listening to us later tonight. Go ahead, Bridget.
Again, that's so heartbreaking to hear, because you can really hear the struggle that her daughter is living with. And so I think that mom is on the right track. I would definitely encourage her to, again, check in with a healthcare provider. Potentially it might be helpful if her daughter has somebody even at school school counselor, somebody she could talk to about some of her concerns. The challenge we have really is that, again, we're living in a diet culture that teaches us that we should fit in by manipulating our bodies, whether it's to a certain weight or a certain body type. And there's a great example that many adolescent girls are focused on their size, and it's scary to hear also the way that they talk about their bodies. And so there's that desire to fit in by manipulating our bodies, or that it should look one way. And here's where, again, we go back to some normal adolescent growth and development and understanding that. And I think it's great for parents to be able to provide some education around that. And also be able to talk to your daughter about, is something different with your friends? Is something different with your peer group? What is she really seeking? It's probably a good way to think of it. Is she getting messages from somebody from the media, from somebody at home? It's always okay to ask those questions.
Right.
And I think it's good to have that curiosity about it. But it's definitely, again, not normal to have that hyper-focus on your body.
Right.
Or that desire to fit in.
Right. It was always my understanding, too, that when you say I feel fat, that's more of a psychological term, meaning you don't feel good enough. That's not really maybe, physically what you're feeling, but it's a loaded statement.
It is a loaded statement. We'll joke that fat is not a feeling, because of course we talk to many of the the clients and families we work with here at Clementine, we talk a lot about feelings and using feeling words and descriptions, and fat really isn't one.
Yeah.
And so when we hear that, we're like, okay, fat is a word. Now tell us more about what you're experiencing in your body. What emotions are you having? Being able to talk about that from different angles, because that's what they're really struggling with. That's what they're really seeking. Or they may be saying, I don't fit in and I feel uncomfortable about that. Or my body's changing and I'm uncomfortable with that, and I don't know how to tolerate that. And so by just saying I feel fat, it's quick. But there's so much subtext to that, and I think that's where we need to kind of lean in and get information.
Right. And before we run out of time, I have one more question from Kathy, and Kathy is from here in Houston, and she writes, Hi, Dr. Simotas. I have a 6-year-old that only wants to eat pancakes for breakfast. She pours lots of syrup on it. Is there something I should be worried about? Should I force her to eat more healthy things like eggs on a daily basis? Thank you, Kathy, again for that email. Bridget, I'm going to let you go ahead and answer that.
Sure. I would say at that age, again, I would continue to offer the food. You know, maybe with the pancakes, have something else, have egg, sausage, something that would be a balance to that meal. And so I would offer it. And sometimes for younger kids, if they continue to see it, then they may try it one time. They may decide they don't like it. That's all okay. But we don't want to just avoid it. Right. And so for some, by offering it, they even have the visual cue of, oh, there it is again. Maybe one day I'll try it. Right. And so it may take multiple times of offering it. And this is what we see with some kids who are more of the picky eaters. And sometimes it can be like extreme picky eating. And so I think it's that exposure to food that's important. And so that's the way I would answer that first. Most of the time, kids' bodies find a way to get the nutrition they need. But again, if you have a child who does fit in that more of the overly picky eating food category, you'd always want to check with the healthcare provider to make sure that they're meeting their nutrition needs. And if not, then find ways to help them get what their body needs. But I would also encourage them to continue offering the food as well.
Right. That's a good point. I know we're running out of time. Can you let our listeners know a little bit about your center and how they can get in touch with you if they have more questions?
Definitely. Again, I think you gave our website. It's www.clementineprograms.com. And we are in the Woodlands, just outside of Houston. And I would direct them definitely to the website, and all of our contact information is there. Ways to find us, get connected. You can also find us on social media as well. And so we have an Instagram page, Twitter page, and I would encourage people to follow us there. And we occasionally will post stories that can give parents some education about eating disorders, nutrition education, emotions, really anything that is part of the underlying factors of what we do on a daily basis. And so that's another great way to get in touch with us. And again, we offer the residential level of care, which is the highest level of care outside of the hospital, but in a comfortable setting. And so I would absolutely encourage people to reach out and get more information about us. We are newer to the area. We opened in July.
That's
and
wonderful.
So we're very glad to be here.
That's Bridget McCauley, licensed professional counselor at the ClementinePrograms.com. That's CLEMENTINE programs.com. It's been an honor to have you on, and I hope that you join us again in the future. Helen, thank you so much for joining us today. As always, I want to leave you with an inspirational thought. This one is from Martin Luther King. The ultimate measure of a man is not where he stands in moments of comfort and convenience, but where he stands at times of challenge and controversy. Remember, knowledge is power. I'm Dr. Alexandra Simotas. This is Her Sex, Her Health. This is 90.1 KPFT Houston.